I'm Dawn Wilkins, Infection Preventionist for Elkhart General Hospital, and this is the EGH Respiratory Training video. In this video, I will be explaining the use of the 3M VersaFlow Powered Air Purifying Respirator, or Papr. After viewing this video, you will be expected to be competency validated by attending a skills lab for use of the Papr. You may not use the Papr at EGH until you have been appropriately competency validated for use. A Papr is a positive pressure respirator that uses a battery-powered blower motor to draw contaminated air into the unit. The contaminated air is pulled through a high-efficiency particulate air filter, or HEPA filter, to remove fine particles or germs. Clean air is blown through a breathing hose connected from the motor housing unit to the user's headgear, which circulates around the user's head and out of the headgear, creating positive pressure. The user's own respirations are also filtered out of the headgear. Unlike a tight-fitting N95 respirator, the Papr does not require fit testing annually. However, EGH does require skills validation for use of the Papr every year. Paprs are the respirator of choice for all associates and staff at EGH when any potential exposure may occur with infections that are transmitted via airborne precautions. The Papr may be excluded from use in 3 patient care circumstances, and associates or staff may be fit tested for the use of the N95 respirator if providing care while working in MRI, performing any sterile procedures on patients in airborne precautions, or responding to an emergency code in patients in airborne precautions. Papr cards are available by contacting Materials Management Distribution during normal operating hours. If the department is closed, please contact the nursing supervisor. After use, Papr carts must be returned to Materials Management Distribution for full decontamination. Please return the Papr carts to the marked specified area next to the morgue. Papr carts come fully stocked with 4 fully assembled and fully charged Papr units. The first and second drawers have dedicated patient care equipment. The third drawer has new headgear. The fourth drawer is reserved for those who require the use of the N95 respirators. I will now demonstrate how to don the Papr. The first step is to ensure you have adequate battery life. Turn on the system by depressing the power button. Hold the power button down until the respirator powers up. Read the battery LED indicator. Any reading less than 3 bars requires a battery exchange from distribution. LED indicators will go into sleep mode while the Papr is in use to preserve battery life. To check your LED indicators at any time, simply depress the fan button and the LED indicators will return promptly. Next, perform an airflow indicator check. Do this once daily while each system is in use. Detach the breathing hose from the unit. Insert the airflow indicator into the outlet in a vertical position. Run for 1 minute. The bottom of the floating ball must be at or above the letter H for the entire 1 minute. If the floating ball fails to float at or above zone H, take the system out of service, label with reason for failure, and send to clinical engineering. Now perform the low flow alarm test. Do this once daily on each system while in use. Remove the airflow indicator. I'm sorry, don't do that. With the unit on, tightly cover the outlet motor blower with the palm of your hand. The motor will speed up to compensate for the low flow. Continue to make a tight seal. In less than 30 seconds, the unit will sound an audible alarm, make a vibratory alarm, and the filter loading flow LED indicator will flash red. Remove your hand. In less than 30 seconds, all alarms will cease and the unit will return to normal functioning. After the unit returns to normal functioning, you can return the breathing hose back to the unit. Next, obtain your headgear. Inspect your headgear for any rips or tears. Examine the face shield for any cracks or visual distortion. And then examine the elastic to make sure it still has good elasticity. If any are present, you need to replace your headgear. Headgear is for single person use only, but may be used multiple times by the same person. Please do not discard after use. Place your name on the headgear with a permanent marker and clean and disinfect after each use. Store in a plastic bag within your unit. Last, don the unit. Attach your headgear to the breathing hose. Make sure it clicks into place. Make sure the unit is on and use the belt to attach the unit to your body. Make sure to tighten the unit to your waist so it fits snugly around your waist and above your bottom. Pull the headgear on over your head and ensure that the gray forehead piece is directly above your eyebrows. There are pieces inside of the headgear. Make sure that those fit to the crown of your head. The sides of the headgear should be in front of your ears, not behind your ears. Once the headgear is on and in place, perform hand hygiene and enter the room. To remove the unit, exit the room and never remove your unit while you're inside of the room. So exit the room and shut the door, perform hand hygiene, and you can now remove your headgear. Unbuckle the unit and make sure you place your unit on a solid surface. You can turn off the unit by depressing the power button and holding it until the unit powers down. And then to detach your headgear, just press the purple band around the hose and it will come apart. Clean and disinfect your headgear after each use and place in your plastic bag and store somewhere within your unit. Thank you for watching the respiratory Papr video, and please wash your hands.